Hello, everyone, and welcome to my channel. My name is Nikki, and I'm a nurse coach and consultant, and I am super excited because it is Black History Month. And I want to use this time to really talk about, for the whole entire month, ways that we can elevate and think about the role of Black nurse founders. So, what we're going to be talking about is recognizing the contributions of Black nurse founders. So there are so many Black nurses that have made such a tremendous difference in the lives of their patients and their colleagues. And I did a keynote presentation for the Association of Public Health Nursing, in which I was talking to public health nurses about racial justice and microaggressions. And as I was talking about it, of course, I had to share some of the accolades and the contributions that several Black and Brown nurses have made to this profession. And I just want to pause and say some of their names. And I would love if you would drop some of the names of Black nurses that you know in the chat that have made significant contributions to our profession as well. So, Mary C. Cole, Mary Mahoney, Ethel Jones Kirkland, Susan King Taylor, and more recently, I will say one of my dear friends and who is a congresswoman, Lauren Underwood, as well, who I just admire and think has done such amazing work. These are all people that have made such an amazing contribution to nursing, and we have to say their names and we have to teach about them. The way that I work in developing racial justice curriculum is explicitly placing them in the curriculum so that we can uplift and we can integrate these voices into the overall perspective of what we offer as nurses. And these nurses of color who have been founders have been deliberately erased from our history in ways that have made it very difficult for us to see how they have created such an amazing contribution. I want to pause and talk a little bit about the National Black Nurses Association as well. Due to the National Black Nurses Association, so many more Black and Brown people actually received the COVID vaccine. They deliberately went out, met with people, went to churches, went to different healthcare organizations, and they helped to support them in making that very important decision. And without their voice and their support and their actions, not nearly as many people would have actually been vaccinated. And that's the point here. We need these voices so that we can actually see effective changes in health equity for our clients. And some of the ways that I recommend, if you are an educator or an academic nurse leader, to honor the rich history of Black nurse founders this month and to honor the heritage is to teach about them, to share what you know about them, and to integrate that into the curriculum that you have. Of course, we need to hire more nurse faculty of color, which is this challenge in and of itself. And these are things that I'll be talking about throughout the month. We have to be represented in these leadership positions. 10% of nurses are actually Black nurses, but they are represented in executive leadership positions at less than 6%. And we know, again, without having folks that look like us in these leadership positions, we may not get our needs met as well as we need to. And then another thing that I'll talk about is how we can stop over disciplining and over scrutinizing Black nurses at work, in schools, so that they can better able to do their job and that they can actually share their work with others in a more effective and impactful way. These are just some of the things that I want to talk about this month. Whatever has hit you, struck you, please drop it in the chat. Let me know. I'm super excited to continue these conversations, and I hope that you enjoy this time in history.